Exploring Structural Therapy and Scoliosis. So our method, SST, works for many spine conditions. I want to just give a specific kind of honorable mention to scoliosis here. So the way we look at scoliosis is usually looked at as lateral curvature of the spine. That means the spine is off, it is bent to the side. And therefore, it's always looked at as what are the bones doing? The bones are crooked. And we say, well, what's pulling the bones, right? What is pulling the bones out of alignment, right? And I want to give you that visual and then kind of explain how this can be effective for scoliosis and in which capacity. So scoliosis in this analogy, right? So we've got our fascia suit, our famous fascia suit and the skeleton, right? Scoliosis would be that the spine is being bent, right? So let's do this to Brady. Let's torture Brady, okay? So what I'm going to do is I'm going to give Brady actually a myofascia restriction at his right hip here. And I'm gonna pull and I'm gonna pull and he's gonna, can you see what's happening, right? Can you see the scoliosis, right? Okay, his spine is bent and you can visualize with the skeleton what's happening in here, okay? Now, in this position, right, Brady can even have a, whoop, there we go. I gave him a little bit more of a fascial restriction. He can even have spine fusion and even a Harrington rod to straighten his spine, but that connective tissue still has this pattern going on. So the way we address scoliosis is we look at where that restriction is that's pulling that spine out of place, and we start to free things up and literally teach that individual to stand differently, actually. So they're not collapsing into where that spine is bending, and therefore, the way we look at it, we affect scoliosis positively. What do I mean by that? Can I go in there and change bones, wedge-shaped bones and deformed ribs? Nope, I can't. But I'll tell you what we can create by doing that means that person with the scoliosis doesn't have a shoulder problem, a sciatica problem, a spine problem, a foot problem, and a knee problem anymore. And I'm gonna give a perfect example, which is me, because I have a scoliosis. So I'm going to do the classic Adams bend test for it so you can see that my rib cage is deformed as a result of my scoliosis. So if I turn around, this is how they test for it, and I do a forward bend, what I want you to look at, and Brady, can you point to the right rib cage to what's happening there? So can we see how there's that rib hump? That is the lovely term for this, right? So this means my rib cage is twisted, okay? Now, if I just collapse into my scoliosis, you'll be able to see it, but I choose not to do that because that's not going to feel good. I choose to stand in my new pattern and to keep opening up my fascia suit to balance that out. I still have a scoliosis, but I live with no pain, and that's what we're looking for. I am not looking to go in there and reset bones that have deformed. What I care about is how I feel in my body, which means don't live with pain, and I can hike and I can swim and I can do whatever the heck I want. So that's what I mean, it can positively affect scoliosis. I am not saying we're gonna get rid of your scoliosis, but we can give you a fantastic life. You can give yourself a fantastic life and still have a scoliosis and not suffer from it. That would be our point.